Welcome and thank you for joining us today for USDA's Food Safety and Inspection Service inaugural 50-state webinar on Listeria Controls at Retail. My name is Dan Puzo and I'm Director of the FSIS Outreach and Partnership Division here in Washington. A couple of housekeeping items before we get started. First, please mute your phone line to ensure there's no feedback, background noise while our speakers are presenting. Second, there's a lot of information we want to cover today in this 1-hour window, so please hold any questions until the end of the presentation where we have a lot of time for them. Lastly, this webinar is being recorded and will be made available to the public in the near future. You may request a copy by contacting the Small Plant Help Desk at 877-374-7435 or through email at infosource@fsis.usda.gov. We're also planning to have the webinars available on the FSIS website in the near future. And I'd like to remind you to please mute your phones until it's time for the Q&A session so that there's no feedback or background noise. I also want to add that this webinar is the first time that I know of that FSIS has reached out to our public health partners in all 50 states, U.S. territories, and tribal lands to convey industry-focused food safety information. So thank you all for being a part of this. Now it's my pleasure to turn the program over to our moderator, Commander Jeff Tarrant, U.S. Public Health Service. Jeff?
Thanks, Dan. This webinar is designed for state public health officials who oversee retail food service operations and to provide an overview of Listeria monocytogenes, discuss the recently updated food safety inspection documents, FSIS best practices guidance on controlling LM and retail delicatessens. The document provides practical steps that retailers can take to prevent ready-to-eat foods that are prepared or sliced in retail delis and consumed in the home, such as deli meats and deli salads, from being contaminated with LM and thus a potential source of listeriosis. As told, we've got a great lineup of speakers. In the next hour, we'll cover the basics of Listeria monocytogenes with a presentation by Kelly Jackson, a surveillance epidemiologist with the Enteric Disease Epidemiology Branch at the Centers for Disease Control and Prevention in Atlanta, Georgia. Then Christina Barlow, senior microbiologist with the FSIS Office of Policy and Program Risk Innovations and Management staff in Washington, will present the FSIS best practices guidance for controlling LM in retail delis and provide recommendations and actions that retailers can take in the deli area to control LM contamination of meat and poultry products. And then we'll conclude the webinar with a question and answer session moderated by Caitlin Keller, Program Specialist with the FSIS Office of Outreach, Employee Education and Training, Outreach and Partnership Division. So with that said, I'll turn the microphone over to Kelly Jackson. Kelly, are you on the line?
I am. Thanks, Jeff. So today I will be providing a brief overview of Listeria monocytogenes, reviewing recent trends and outbreaks, and describing 2 recent outbreaks associated with environmental contamination at retail. Next slide. Listeria monocytogenes is a gram-positive bacterium that can be found in soil and water, and unlike other foodborne bacterial pathogens, Listeria can grow at refrigerator temperature. Next slide. Human infection occurs primarily through foodborne transmission. Although infection is rare, with approximately 1,600 cases per year in the United States, it is deadly with a case fatality ratio of greater than 15%. Next slide. Certain populations are at increased risk for invasive listeriosis. Groups at higher risk include the elderly, persons with immunocompromising conditions, pregnant women, and their newborn infants. In the elderly and persons with immunocompromising conditions, listeriosis typically presents as a bloodstream infection or meningitis. In pregnant women, the infections can be asymptomatic or may cause a flu-like illness. However, infection may spread to the fetus and result in miscarriage or stillbirth. Live-born infants may have severe bloodstream infections in the first few days of life, or develop meningitis a few weeks later. In healthy persons, Listeria can cause relatively short-lived diarrhea and fever. During 1998 to 2003, there were 11 listeriosis outbreaks in the United States where a vehicle was identified. 5 of these were associated with delicatessen meat and 3 with hot dogs. Following a 1998 outbreak associated with hot dogs, in which 108 people became ill and 14 deaths and 4 miscarriages were reported, industry made efforts to make hot dogs safer. There have been no listeriosis outbreaks associated with hot dogs since 1999. Similarly, following a 2002 listeriosis outbreak associated with turkey deli meat, in which 54 people became ill and 8 deaths and 3 miscarriages were reported, USDA tightened regulations and industry added growth inhibitors and other measures to protect against Listeria contamination. Next slide.
I'm going to send the link to you. Just
in the years following industry intervention, the number of outbreaks associated with deli meat and hot dogs have declined. Although there were two outbreaks associated with deli meat between 2004 and 2012, they were much smaller. Last year, there were 2 small outbreaks associated with environmental contamination of deli meat reported by our state partners. I will provide a brief overview of them. Next slide, please. In fall 2014, 3 listeriosis cases were reported from a single town. All of the clinical isolates were indistinguishable by pulsed field gel electrophoresis, or PFGE, and highly related by whole genome sequencing, or WGS. Interviews of the patients revealed several common exposures, which led the health department to collect food and environmental samples from several locations. An environmental isolate collected at a deli reported by at least 1 case yielded Listeria with a different, unrelated PFGE status. Sliced prosciutto from a restaurant visited by all 3 patients yielded Listeria monocytogenes that was indistinguishable by PFGE and highly related to the clinical isolate by whole genome sequencing, while a sample from unopened product was negative. A review of records at the prosciutto production facility revealed no Listeria positives in 2014. Only 1 patient reported consuming prosciutto.
844.
Next slide, please.
9904. And the next one is.
We're going to request that please people mute your phones if you're not speaking. Thank you.
The source of the outbreak was attributed to ongoing environmental contamination at the restaurant. A malfunctioning cooler likely contaminated the open prosciutto. In total, 4 persons became ill, all of whom were hospitalized, and 2 died. Next slide. Around the same time, a similar situation occurred in a second state where 2 cases of listeriosis from the same town were reported with clinical isolates indistinguishable by PFGE. Interviews revealed that they had both reported 2 common stores, a grocery store where both patients purchased potato salad, and a restaurant where both purchased ham. Both locations were inspected. Next slide, please. No violations were observed at the grocery store, where no problems were noted with cold storage records, and the deli slicers were new models, with no crevices, pitting, or difficult-to-clean areas. The slicers there were broken down and sanitized every 4 hours. Inspection of the restaurant revealed refrigeration issues, no food safety manager, and an older model meat slicer with difficult-to-clean areas and exterior body residue. Work surfaces were not cleaned every 4 hours, among other violations. This suggests that the illnesses were linked to the restaurant. Next slide, please. In conclusion, listeriosis outbreaks associated with deli meat and hot dogs occur less frequently than in the past. However, contamination at retail remains an important contributing factor in more recent outbreaks. Next slide. I would like to thank you for your attention and turn it back over to Dan at this time. Thank you.
Thank you, Kelly. And now we're going to hear from Christina Barlow. Christy?
Thank you, Doug. And today I'll be speaking about the FSIS Best Practice Guidance for Controlling LM and Retail Delicatessens. This guideline is available on our FSIS website, and the link is provided within the slides, so you can access the full guideline. Okay. So this retail guideline is one of the only guidelines that FSIS has developed for retailers. Most of our guidance is for the USDA-inspected, regulated meat and poultry processing industry. But this one is specifically for retailers, and it's to help them to put into place practices that they can use to help control Listeria spread and cross-contamination within retail delis, and hope to avoid the illnesses as were seen and described in the previous presentation. So just a little bit about the guidelines. It includes actions that were identified by the Interagency Risk Assessment, LM and Retail Delicatessens. It was developed jointly by the FSIS, FDA, and CDC. And that looked for typical causes of illness increases from actions that retailers were taking. We got that information from that risk assessment to include in this guideline. We also pulled information from the FDA Food Code, scientific literature, other guidance documents, including from the FDA and other countries, as well as the lessons learned from Listeria Control in meat and poultry processing establishments. The guidance contains steps that retailers can take to maintain deli products in sanitary conditions, and also a self-assessment tool that they can use to determine if the practices that they have in place can control LM, or they need to adopt additional practices. So FSIS previously issued this guideline about a year ago in June of 2014. It has been revised in response to comments. So I'll just go over some of the comments that were received in the revisions that were made.
Yes, very
There is some background noise, so again, if you could mute your phone so everybody can hear, we'd appreciate it. So the revised guideline, we clarified that food processing equipment should be disassembled during cleaning and sanitizing. So when it's cleaned every 4 hours, according to the food code, it should be disassembled as much as possible to get down into those nooks and crannies that could harbor Listeria. We also added a recommendation that retailers scrub surfaces during cleaning to prevent biofilm formation. Biofilms are sort of like plaque bacteria. They can form on equipment, and the Listeria forms these biofilms, and it becomes much harder to clean once the film is formed. So we recommend that equipment surfaces are scrubbed to address these biofilms. We also clarified that retailers should rotate or change sanitizers to prevent LM from developing resistance, and that could increase the niches in the environment and the formation of biofilms. We clarified as well that the information in these guidelines are recommendations. They are not regulatory requirements, except for in certain states where the food code's been adopted, but they are recommendations to control Listeria within the retail facilities. So why was the guideline developed? We talked about this a little bit already, but we had a previous risk assessment that showed that of the listeriosis illnesses that have been attributed to deli meat, about 83% are associated with deli meat sliced in retail delis. And that's compared to the sliced products that you buy packaged already at the grocery store. So we did see that there is an additional risk coming from those products that were being sliced at delis. Typically, when we look at the products that are packaged and that come from FSIS inspected facilities, we've seen a very low positive rate. It's decreased quite a bit over the years. Yet the data from the CDC shows that listeriosis illnesses overall have been plateauing. So we haven't really seen a concurrent decrease in the illnesses that are occurring from listeriosis. So FSIS is working with our public health partners to look to see where additional risks could be from listeriosis, focusing on further areas where we could be working. And the retail deli was one of those areas. Also to mention that FSIS does have the authority under the Act to ensure that meat and poultry products are not adulterated. And that includes at retail and all steps through distribution of the products. So this next slide is information from the FDA website. You can see the link down there at the bottom. And this shows you an example of what can occur specifically in a retail deli with a slicer. So as you can see, residue can form underneath the slicer blade, along the blade guard at the handle and the seals, and form this black residue that's difficult to remove. And so listeria can be harbored back inside in those points and then recontaminate the meat each time it's sliced. So that's why it's important to disassemble the equipment when possible to make sure that those areas are cleaned during the cleaning process. Again, the guideline provides practical recommendations that retailers can use. We have divided those into 4 different areas that are focused on actions retailers can take as far as handling the product, cleaning and sanitizing, facility and equipment controls, and employee practices. So again, retailers should be aware that some of the guidance, especially the ones based on the food code, may be requirements in certain states. So moving on to the specific recommendations from the guidelines, the recommendations on product handling. As I said, these deal with the product itself and making sure that when retailers are selecting products for sale, and they look back and use products that have been treated so that they will control listeria growth. So the first recommendation is using products formulated with antimicrobial agents, and those could be items like acetic acid or sodium diacetate, lactic acid, citric acid, when possible, to prevent the growth of listeria. So this is the most significant finding by the risk assessment. The risk assessment found that if these products are used in the deli, then the risk of listeriosis illness could be decreased by approximately 96%. So that's a huge decrease in the risk of illness. So it's important that retailers look, when they're using these products, look to see what types of products they're purchasing from suppliers. They can look at the labels to see if these antimicrobial agents have been included in the product and try to use those products when they're choosing products to sell to consumers. We also recommend that retailers use products that have been treated, such as through high-pressure processing or another treatment to control LM. And that was also found to significantly decrease the listeriosis risk. And retailers can obtain certificates of analysis or letters of guarantee from their suppliers to see whether the products have been treated using one of these processes. Another recommendation was not to pre-slice products in the morning after cleaning. We recommend that retailers slice each of the products on demand, like if a consumer approaches the deli counter, that they slice the products for them, rather than slicing products early on to store up. You know, it might seem nice to walk into a deli and see a beautiful case all filled up with sliced products and some garnishes and things like that. But it was actually found to be less safe and lead to more potential risk of illness to do it that way. We also recommend returning the products promptly to the refrigerated unit. I guess when a deli gets busy, there may be the potential to slice the products and then leave them out for a while before they're quickly wrapped and put back into the cooler. But the risk assessment found that storing the products at or below 41 degrees Fahrenheit, as recommended in the food code, does decrease the risk of listeriosis, has a significant impact. So that's an important finding. And one of the outbreaks that was previously described looks like one of the causes could have been a broken cooler. So temperature control is really important when controlling listeria growth and spreading. Right, moving to the next slide. So these are our recommendations surrounding the cleaning and sanitizing of the deli. Cleaning and sanitizing become really important in preventing Listeria harborage, the formation of biofilms, as I was mentioning previously, as well as cross-contamination, which is the movement of Listeria from site to site within the deli. So we recommend that retailers develop written sanitation procedures that describe how the utensils and the other pieces of equipment, like the slicers, will be cleaned and sanitized prior to use. We also recommend avoiding unsanitary conditions within the deli and documenting the actions it performs to ensure that sanitation is performed on a regular basis.
Unsanitary conditions.
Oh.
You know, to hear.
Well, the next slide, we're talking about cleaning the utensils and equipment used to handle and prepare and store ready-to-eat products at least every 4 hours, and this is a food code recommendation. That finding was also found to be significant in the risk assessment. The risk assessment found that control of contamination, cross-contamination at all points would reduce the predicted risk of illness by 34%. As I said previously, we recommend scrubbing surfaces to prevent biofilm formation. And also, we ask that retailers consider changing sanitizers as needed to provide more effective control. They can alternate sanitizers. For example, if they use quaternary ammonia during the week, they could use bleach on the weekend. And that's something that food production facilities have been doing for quite some time to help Listeria from developing resistance. Next slide. Do not allow conditions in the retail facility that could cause the product to become adulterated. That includes making raw products right next to ready-to-eat products or using the same equipment or surfaces. Ensuring that the walls, floors, and drains and overhead structures are in good repair. They're not dripping condensation down on the product. Also, not performing construction during the slicing of ready-to-eat products. There may be instances where the retail stores have to rip up floors or they have problems with pipes and things like that, and that could spread dust that carries Listeria onto the product. So we recommend not doing that during when the product's being sliced or exposed to the environment. Next slide, we're talking about the facility and equipment controls that retailers could put in place. We recommend maintaining tables, slicers, and other food contact surfaces so that they're easily cleanable. They're made of stainless steel or some other material that can be easily cleaned and don't have gouges or rust, other things that could keep it from being able to be cleaned and cause Listeria harborage. We recommend cleaning the overhead structures as often as necessary, keep them free of the condensation, and also keep water from pooling on the floor or other surfaces in the deli area. Practices that retailers could take. We recommend that retailers ensure that employees wear gloves or use other suitable utensils, and that's a recommendation in the food code. Also, training employees in sanitation practices and safe handling procedures. And And that includes having training materials in different languages. A lot of the employees in retail stores may not speak English as a first language, so it would be important to have that information so it's available to them and easily understandable. Also providing adequate facilities, including soap and water for employees to wash their hands. Implement a policy to ensure that ill employees don't work with open food items, including ready-to-eat food. Limiting traffic in the deli area, developing traffic flow patterns, because as you know, it can be kind of tight back there. You could have things like milk crates and things, cardboard boxes coming in and out of the deli area. Not all of the traffic can be controlled, obviously, since you've got people and carts and everything coming into the grocery store. And it's important to make sure at least the food that's exposed within the deli area is protected so it doesn't become contaminated with Listeria. Also making sure that employees change their aprons or their outer clothing, such as their frocks or smocks, when it becomes dirty. Gone are the days of walking into the butcher and seeing the guy covered in blood, So we want to make sure that that's all kept neat and clean, and also the retailer can benefit them because, if it's cleaner, the customers are more likely to shop there. So we emphasize that as well. Okay, and so here, just this last slide has some resources can be used. There's additional guidelines retailers can use. FMI has a good one. STA has a flyer on keeping deli slicers safe. Penn State also has a good guideline for controlling Listeria in retail establishments. That's the end of my presentation.
Thank you, Christy. Okay, next slide. Do a little shout out here for the Small Plant Help Desk, which its main focus is really very small meat and poultry egg product facilities, but we are there Monday through Friday, 8 a.m. to 5 p.m. to answer your calls, and that's 1-877-FSIS-HELP, or you can email us at infosource@fsis.usda.gov. But we are a one-stop shop for answering technical questions here within the agency. So if we don't know the answer, we will certainly find the answer for you. So if you have any questions, please feel free to call us. We've got a team, and you can see all 5 of them there on the screen. They're all waiting for your call right now. Right? Slide. We have some contact information. If you have any questions or concerns about today's presentation, please feel free to contact myself, Caitlin, Christina, or Kelly with regards to any of the questions in the presentation. And with that, I'd like to hand the microphone over to Caitlin Keller, who will moderate the question and answer section. Caitlin?
Thanks, Jeff. We'd now like to open up the line to listeners who have any questions on Listeria, Listeriosis, the FSIS best practices guidance document, or any of the specific steps that retailers can take to prevent ready-to-eat foods from becoming contaminated with LM. If you have a question, please first state your name and affiliation for asking a question. Are there any questions on the line at this time?
I have a question for you, Christy. Right now, the guidance document that you sent out, or we have posted, is this a requirement for processors and facilities?
Thanks, Jeff. No, right now these recommendations are recommendations that are included in the guidelines. And as I said, the food code lists the requirements, and the state or local health departments or decide whether to adopt those. And so, but these are options that retailers can use to help control Listeria, and they're based on the risk assessment, as I said, the scientific literature and other information. So we hope that they will adopt those voluntarily and use them to help decrease the risk of listeriosis from deli products.
Okay, thanks.
Are there any questions on the line? Okay. Well,
can you hear me, Christy?
Yes? Is there a question?
Yes. Can you hear me?
Yep, go ahead.
If listeriosis has been significantly decreased in industry, how is it getting into the retail establishment?
So this is Christy. Listeria lives in the dirt and the soil, so it survives outside during the winter and the summertime. So it's a pretty hardy organism. And then it gets into grocery stores, on the people's shoes, on the carts, it's down in the drains. It can even be in the dust and back behind the walls. It comes in to the retail facilities, and it's pretty much everywhere. People like to say Listeria is ubiquitous, but they often use that as an excuse for not being able to control it getting on food. But, you know, it can be down in the dirt and the drains, the sinks, and but then it gets up onto food contact surfaces and forms harborages, like we were discussing, and also on the product. So, you know, it ends up getting in, and then it's a matter of making sure the sanitation is good enough to keep it from contaminating the product. It is possible that some low number of products, when they leave processing establishments, carry it, but like you were saying, and we said before, the incidence has gone way down, so we don't expect that to be the major source. It's just mostly the dirt, not cleaning enough.
Yeah, I remember the time past that it sometimes would travel in boxes, like in transportation facility, you know, transportation and trailers, and then you're bringing the boxes into the, you know, into the back room, to your stock room, but you're walking through the kitchen, and it's picking up dust and it's moving it around.
And a low number of people, employees might carry it too. There's a low number of carriers who can transmit it onto products, so that could be another source.
That was a great question. Are there any other questions on the line? Okay. Well, thank you again, everyone, for your participation in today's presentation and your ongoing commitment to reduce and control LM contamination of ready-to-eat meat and poultry products. We're all pieces in the public health puzzle, and none of us can tackle this problem alone, so we appreciate your work as well. FSIS encourages retailers and public health officials to...
I have one more question. Sorry.
Okay. That's okay. Go ahead.
Hi, I'm Lydia Brown from the Rhode Island Department of Health. Can you please tell me why it is now that it's the best practice to cut the deli meats only in the morning? I mean, what is the science saying to corroborate this finding?
This is Christy, and that's a good question. That was a finding of the risk assessment. So they looked to see in establishments where they were slicing products in the morning and leaving out the deli meats exposed throughout the day. And there was just more potential for cross-contamination at that point and letting Listeria grow. So it just, by slicing it in the morning, then it exposed to conditions within the deli case, and there could be cross-contamination from the air and from the dripping and the things that we've been talking about. And so it just led to an increase in illness when that practice occurred. And the risk assessment was mostly done through computer modeling, and it looked at all the different avenues, and that was one that showed a significant increase in the risk of Listeria.
You ever looked upside down in there?
Are there any final questions on the line?
Swallows.
Okay. Well, one quick note again, as Dan mentioned earlier in this presentation, we have recorded this webinar and it will be available on our website. In the interim, you can request it from the FSIS Small Plant Help Desk, which is available as well for any food safety or food defense related questions. They can be reached. Yes? Is there a question? Okay. As I was saying, the Small Plant Help Desk can be reached by phone at 1-800-FSIS-HELP or email at infosource@fsis.usda.gov. And it's manned from Monday through Friday, 8 a.m. to 5 p.m. Eastern Time. Again, thank you all for your participation today and your ongoing commitment to making U.S. food safety, food supply one of the safest in the world. Thank you.
We count. Everybody.
Your conference is ending now. As requested by the host, please hang up.